I'm a fertility doctor and an OBGYN. I'm Dr. Natalie Crawford, and I am the specialist on if you should freeze your eggs or not. And I get asked this question every single day. So every day that I am seeing patients, there's somebody who is considering preserving or saving their fertility with egg freezing, which I love. But what should you know if you are thinking about undergoing this process? What information could change it for you? If you love learning more about your body, I would love for you to subscribe to the channel. This channel exists to learn more about your body and how you can empower yourself with knowledge to have the life that you want. And education is power. So please subscribe and join us. What is egg freezing? Egg freezing is taking 1 month's group of eggs out of your body and then freezing them to save them for later. This is a huge advantage because, as we know, when you get older, your eggs start to break down, meaning the chromosomes inside start to lose their position, and you have an increased prevalence of something called aneuploidy or abnormal eggs. The older you are, more of your eggs are going to be genetically abnormal. That is why it's harder to get pregnant when you're older and you have a higher chance of miscarriage. It's not because you have fewer eggs as you get older. That actually doesn't impact your chance of pregnancy, but having more of them genetically abnormal significantly does. And so, as we see people who are chasing these big dreams and career goals, delaying their family and starting their family, unless we intervene, we might have less children or no children without understanding what this means. So, egg freezing is a way to take your eggs and save them at this genetic level versus letting them get more abnormal with time. If you have ovaries, you're born with all the eggs you're ever going to have inside a vault in your eggs. When you're born, the vault is full. Throughout your life, eggs come out of the vault. And when the vault is empty, you're in menopause. So you only have a set number of eggs, but they are with you your entire life. And they are exposed to the same things you expose your whole body to. They do break down over time. And what we mean by that is every single egg is 46XX. If that's your normal chromosomes. You actually have 23 pairs of chromosomes and then a sex chromosome. So you have 2 copies of every chromosome. Those chromosomes are held perfectly apart and held apart by these little meiotic spindles or proteins. And they sit that way until you ovulate, when they split and you get an egg full of 23X. These proteins break down as you smoke cigarettes, as you're exposed to toxins, and just with time. And so intervening earlier, that's why younger eggs are better. So if you are going to undergo egg freezing, what you need to know, number one, you need to understand the process. So what happens is every month, a group of eggs comes out of the vault. From that group, you are going to have 1 egg naturally chosen to ovulate, and then the rest of them die. And then the next month, another group is going to come out. From there, that group is what you can get to grow when you do egg freezing or IVF. You can't tap into the vault. So we take hormones, the same hormones the brain normally sends out, in order to get those eggs to grow. And it usually takes about a 2-week process where you will come in for ultrasound and blood work and monitoring those follicles as they grow. Each follicle has an egg inside. So the word egg and follicle can be used interchangeably. When those eggs are mature based on follicle size and estrogen level, you will undergo a procedure under anesthesia to take them out. And that's a vaginal procedure with a needle attached to an ultrasound where we enter the vagina and we drain out those follicles and get test tubes full of your eggs. Then you're done and you can do the process again if you want to. It's important to understand that there's different protocols we can use. And when I talk about the protocol, it is a combination of medications both to suppress the body and then stimulate the eggs to grow. We have to do this in order to trick the body because the body normally wants just that 1 egg to grow and we want to get all the eggs possible. So you might want to ask, what's the protocol I'm going to be on? It should be personalized for you. So that's based on your age, your medical conditions, and your ovarian reserve tests. So if somebody ever says, this is the protocol we do here, that's kind of a red flag if they do one protocol for everybody. If they say, in general, for somebody like you, I would do XYZ, that's totally fine. They're trying to give you an example. But you should understand, what is the protocol? How is this best for me? And you should know that it's based on your current stats. If you've undergone a prior cycle, then you want to know, what are we going to do different if you did not get the outcome you wanted? If you got the outcome you wanted, then maybe you do the exact same thing, and that's fine also. The important thing about egg freezing, when I talk about understanding the process, is also to know what happens when you thaw the eggs. And your doctor should walk you through this. Not every egg survives the freeze thaw. Not every egg will be fertilized. Not every fertilized egg will make it to an embryo. Not every embryo is genetically normal. And not every genetically normal embryo will make it into a baby. So, in general, you're going to have about 90% of eggs survive the freeze thaw. 80% of those eggs are going to fertilize. 50% of those are going to make it to the embryo stage. The percentage normal depends on your age. Around age 35 to 36, it's about 50%. And then your chance of a live born baby for a single genetically normal embryo is about 60 to 65%. So if you're 35 and you go through the process and you get 20 eggs and 18 survive the freeze thaw and 14 fertilize and 7 grow out, and you get 3 normal embryos, then you have a 60 to 65% chance of each one turning into a baby. Pretty good chance for one, maybe a second, but probably not 3. You're not likely to hit it every single time. Number 2, you need to understand that egg freezing is not a guarantee. I actually hate it when people come in and they say, oh, this is an insurance policy for my fertility. It is absolutely not. It is a investment in your fertility. Just like playing the stock market's different than homeowners insurance. If my house burns down, the homeowner's insurance is going to kick in and I'm going to get whatever I signed up for. That's not what's going on here. If I need my eggs, it's not a guarantee. This is an investment, and the return on that investment depends on the environment and other factors later on. So some of this is just, I don't know that downstream equation. I just gave you the average, but some people do better than average and some people do worse. So are any of your eggs going to make it into an embryo that is normal or a baby? We actually don't know. And that's one of the biggest risks. It is still an investment. And even if you don't get a high number, it's some opportunity to have a child in a door that's otherwise closing. So that's really important to frame it. And I always ask with this, what is your goal? I have people with different goals. I'm not sure if I want kids. I must have 2 kids, even if I do it myself. I need 4 kids, but I'm starting later. That's fine, because if you want a 4-kid family, but you're not starting your family until you're 37 or 38, it is extremely unlikely you will have 4 children unless you undergo IVF or you save your eggs. That is just the math that what happens with aging. So if you want a big family and you're waiting, you should be talking about fertility preservation. So what is your goal? Express that with your doctor. Should you make eggs or embryos if you have a current partner? Again, it plays into what is your goal. Advantage to embryos is, well, we can know some of that downstream effect. How many actual euploid embryos do I have? The negative is that they are all tied up with that sperm source. And if something in your life changes, you might be losing your opportunity to have a genetic child based on that relationship. So because of that, I really love people to have some eggs, even if they do both, but some eggs to keep that door open because we can't predict the future. And we know your genetics are going to end the ability to have your own genetic child before a sperm sources is going to. Number 3, you need to know your stats. So what is your ovarian reserve? What is your AMH? What is your antral follicle count? How many eggs are they expecting? Otherwise, how are you gauging if you're meeting what you should or not based on your monitoring appointments? And based on that math and your age and your goals, how many cycles are you probably going to need? And should you do them back to back, or should you take time? Or if you're not starting to try at a certain age, should you come back and do more? You should know your stats before you undergo the process. Antral follicle count is an ultrasound count of all the eggs that are outside the vault. AMH is anti-Mullerian hormone, and AMH is made from the cells that surround the eggs outside the vault. So more eggs inside, more eggs outside, higher AMH. Fewer eggs inside because you're running out, fewer eggs per month available, lower AMH. Know your stats and understand how many cycles you may need. Number 4, consider your birth control situation. So we do know, though, if you've been on the birth control pill for a prolonged period of time, it can suppress the ovarian response. You may not get as many eggs as you could if you took a small pill break. We don't know unless you tell us how long you've been taking it, and if you're willing to take a pill break. You may say, no, I can't risk getting pregnant. Great, that's fine. We can go with that. We also can do IVF with IUDs in place, so you don't have to go get your IUD out. We don't see a negative impact from doing this whole process with an IUD in place. But if you have an arm implant, we do need to get it taken out. So make sure you're talking to your OBGYN or see a fertility doctor early enough so we can talk about how we're going to manage your current birth control with doing the egg freezing process, and then what you should know to get back on your birth control afterward. And number 4 is control what you can. This process, there's a lot you can't control. You can't control how fast you run out of eggs, and you can't control how your body is going to respond to the medications. But you can set yourself up to have the best environment possible. This means decreasing inflammation overall. So getting sleep, exercising, not running a marathon, going crazy, high intensity, but keeping your body moving is a good form of stress reduction and helps decrease inflammation. We don't want you training for something hard again. I don't want to up the ante. I just want you moving. And then really focus on avoiding toxins. No cigarette smoke, no marijuana, limiting alcohol. I want you to eat lots of fruits and veggies. I want you to avoid processed meats, sugars, processed foods. Those things are fake and artificial, and your body knows it and it responds so. What we know is that the lower inflammatory environment, the better. This also includes your weight. If you have a goal of, hey, if I'm not ready to start getting pregnant by 35, I'm going to freeze my eggs, you're going to have a better outcome and better egg quality if you're of a healthy weight. So make that a priority for your future later. So keep your body moving, get sleep, stay a healthy weight, and make sure you are taking some good vitamins and supplements. I usually recommend my patients who are freezing their eggs take a prenatal vitamin because it has lots of good nutrients in it, usually a little extra vitamin D, and some CoQ10. So talk to your doctor to see some of those supplements really can start being more beneficial 1 to 3 months before you do the process. Overall, egg freezing is something I'm a huge fan of. I wish it was an option back when I was younger. It wasn't. But now it is opening doors and saving fertility for so many people. Even if you don't end up using your eggs later, it has been shown to improve the quality of your life because you can go through life evaluating relationships for what they are without feeling your biological clock. And it gives you the freedom that you'll be able to have the family you want, or at least a better chance of it than doing nothing. When for any major goal, has just ignoring it been the approach that makes the most sense? Probably not. As always, you can find out more information on my Instagram at Natalie Crawford MD or the As a Woman podcast.